So I use the RAP system. For me, it's respiration, alertness, perfusion, because for me, those are the first three things that I look at in a patient coming through the door. Are they having respiratory difficulties? Not only what is their respiratory rate, but what is their effort? What is their respiratory pattern? Sometimes dogs are hard to evaluate because they pant all the time, and so just saying that dog has a fast respiratory rate isn't enough to evaluate if it's in crisis or not. But looking at their respiratory pattern, are they working really hard to breathe? Can I tell just by the look on their face that they're somewhat distressed about their breathing? Also, alertness comes into play anytime that an animal is in shock. Which shock is basically hypoxia, so we're not getting enough oxygen to the brain, enough oxygen to the tissues. So one of the first signs we see is a change in mentation or a change in their alertness. So if I know an animal went through a very traumatic event and they come in and they're laterally recumbent or they're very quiet, I know that that's not a normal reaction for an animal that's gone through some trauma. You know, they should be pretty bright and alert and bouncing around and scared, and so really watching for their alertness or their mentation also tells me how they're feeling. You know, are they in a crisis? Perfusion is another one. There are a lot of parameters where we can look for perfusion. We're feeling for pulses, we're auscultating the heart, we can take a blood pressure if we have a monitor close, mucous membrane and CRT time. We can check all of those things to look quickly at the circulatory system, because that's another thing. If a patient isn't getting adequate circulation, if they have a decrease in blood pressure, it's not only a sign of shock, but it's a sign that that patient is going to decompensate quickly and I need to take action. So I use RAP as my quick assessment system.